The doctor wanted me to come back and do a more comprehensive cardiovascular and pulmonary exam, meaning check to see how well your heart and your lungs are working. Is this a good time to do that? Alrighty, I'm gonna clean my hands real quick. Thank you. Can you verify your full name and your date of birth for me?
Danielle Miller, in April 28, 2001.
Very good. All right, Miss Miller. Now I'd like you to just stand right here for me. Straight with feet flat on the floor. And I'm going to be inspecting your shoulders. They're at the same level, and the space between your arms here are equal. Could you turn to this side for me? All right, and there are no excessive arches that are noted, no excessive curvature of your spine. Now, are you able to turn around with your back towards me and bend over as if you're going to touch your toes? All right, now your torso is symmetrical, no midline hump is noted. Now I'm going to physically assess your spine. Let me know if you feel any pain or discomfort as I do this. C7 and T1 are supposed to be equal. I'm going to check for that. And they are equal, these two. And no pain or tenderness?
No.
Okay, and I want you to just stand straight up, and then I want you to bend to the right. Good, and bend to the left, and bend as far back as you can, and bend forward if you could. Very good. You have full range of motion, and you didn't have any tenderness or excessive curves. And I'm going to inspect the front of your chest. You appear to be breathing without much effort. Everything appears to be even. There's no sign of distress. Your respiratory rate is within the normal limits. You're not using any accessory muscles. And so now I'm just going to palpate certain areas. All right, just making sure I don't feel any air under your skin, any tactile fremitus. Okay. All right. And I can actually feel a pulse right here at the sternal notch, and there's no increased angle here with your chest, no signs of overinflation. So now I'm going to ask you to take a deep breath every time I place my stethoscope. I'm going to listen for bronchotracheal sounds. I'm going to listen for bronchiovesicular sounds, and I'm going to listen for your vesicular sounds. Now, are you able to turn around for me, Miss Miller? And I'm going to ask you to take some big, deep breaths for me. Big, deep breath. And nothing seems asymmetric, so now I'm going to percuss, and I'm looking for a nice resonant sound between the ribs as opposed to a dull sound. Okay? Okay. Now, with each touch, I want you to say 99, so I can feel whether the vibrations back here are symmetrical. Okay?
99.
A little louder.
99. 99. 99. 99.
Okay. Now we're going to use what's called the bronchophony test to check for consolidation. So again, each time I touch you with a stethoscope, I want you to just repeat 99 for me, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And the sounds are muffled, and that's a good sign. And this last time, what I want you to whisper each time you feel the scope touch you, okay? Alright, so nothing is suspected there. Now we're going to test for what's called egophony. When you feel the scope touch you, I want you to say E.
E, 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 E.
Okay, very good. So there was no change, your E didn't change to A's, so that means no consolidation or fibrosis or anything of that nature is suspected. Now I'm going to just listen to your bronchiovesicular sounds and your vesicular sounds while I am back here. Big deep breaths in and out. All right, now I'm going to check for symmetrical expansion. I'm going to put my hand about the 10th rib down. I'm even going to pull some skin together here. All right, I'm going to squeeze. And then I want you to take a big deep breath in for me. Fantastic, so that showed symmetrical movement. So now, Miss Miller, I'd like you to lay on your back, and I'm going to start by just checking to see if you have any surgical scars here or any other type of scars or trauma, and I don't see anything. And then I'm going to start by just palpating with my fingers, starting at the right sternal border here, at the second intercostal space, where the aortic valve is. And then I'm gonna go over on the left, over the pulmonic, and then Erb's point, and I can actually feel that. And then the tricuspid and mitral valve. I'm feeling for any impulses which may lift my finger, and now I'm going to move over the PMI. That's the apex of the heart where I can feel the impulse. This area is in line with your mid clavicle. That's how I found it. And because you're a thin person, I feel it. It's very bounding here. Now I'm going to listen with my stethoscope, and I'm going to go over the same points. All right, and I'm listening for S1 and S2 sounds, any murmurs, any extra hard sounds, okay? You don't have to do anything. Very good. And now I'm going to just inspect the rest of your abdomen. Make sure you don't have any pronounced pulsations there. All right. And now I'm going to inspect your jugular vein. Would you mind looking over to the left for me? Okay. All right. And I cannot see it pulsating actually, but I can see it in your suprasternal notch here, and I can feel it also. And I'm going to feel your carotids, one side at a time. Just very gentle pressure, just to feel them. All right, and it's very bounding. All right, and I'm not picking up any purring, any thrills. And I'm noticing it's just nice and brisk, okay? So now I'm going to use my scope and actually listen to them. And the next one. Very good. Now I'm going to move over to your arms and your legs. I'm going to start by assessing your brachial pulses here. And then I'm going to assess your radial pulses. Then while we're here, we're going to do a quick test. It's called the Allen's test. And what it does, it just lets me know if you have good circulation from your arteries going to your hands. So I have to do one at a time. So what I'm going to do is I'm going to occlude. I'm going to ask you to tight fist. And I'm going to occlude the ulnar and radial arteries. I'm going to press a little bit. Then I'm going to ask you to let go. See how white your hand is? And I'm going to release those arteries. And look at the blood flowing back to your hands.
Wow.
So you have good circulation there. We're going to repeat on this side. Make a tight fist. I'm going to occlude. The ulnar is a little harder to find. The radial is really easy to find here. And let go. And see how white that is. And we're going to watch the blood flow come back. You have very good circulation there. Fabulous. Then I'm going to move down the thighs. I'm observing for color. We're going to do a quick check of the femoral artery, which is right down here in the groin area. All right, we're going to check the artery back here. Let's check the other one. This is the popliteal behind here. The posterior tibial is right here by the ankle. Posterior tibial on this side. Then I'm gonna ask you to flex. And do you feel any pain in the calves?
No.
Okay. No pain in the calf when we flex. No warmth, no redness, no pain when we flex, no warmth and no redness. And we're just gonna check the dorsalis pedis here. Good, and bounding, and some capri fill. Good. And this ends our cardiovascular and pulmonary assessment. If you need anything before I come back, please press your call light.